Hi everyone, my name is Lan Cao and I'm a doctor of Chinese medicine and acupuncture. Today I will be showing you some basic points that we will be locating. As everyone's body has different dimensions, when we're locating the points according to a particular person's body size, this is referred to as proportional measurement. And this is important when we're locating points to be as accurate as possible. So the first measurement I'm going to show you is the sun. So sun, spelled C-U-N, is the standard unit of measurement of the body in acupuncture. So one sun is the patient's or the person's thumb, and it's measured the width of this middle joint. So two of the joints would be two sun, and three measurements of the joint would be three sun. So that's the first measurement I'm going to show you. The second measurement is three sun measurements. So 3 sun is the length of our 4 fingers, and it's the width of the middle joints. And so this is 3 sun. It's not the proximal joints, but it's the distal joints here. So from pinky to index. With that knowledge, we can begin to locate the points. Today we're going to go over 10 acupuncture points. The first point is GB20. The Chinese name is Feng Chi. It is translated as the wind pond. So in locating GB20, you want to identify where the trapezius muscle attaches to the occiput and the sternocleidomastoid. So in the depressions between the upper portion of the two muscles, I'm going to place a dot where the point is located. Yeah. So here is the sternocleidomastoid muscle, and here's the trapezius, and it's in the depression, clearing the occiput. So indications include headaches, blurred vision, dizziness, colds. So this is an area where inflammation can accumulate very easily. If there's a sudden change in temperature from hot to cold, that can also cause stagnation and obstruction in the gallbladder channel at this point. So the second point we're going to locate is GB21, Jianjing, and it is, the English translation is shoulder well. So GB21 is located at the midpoint between the acromion and the spinous process of C7, and it's at the high, so midpoint and at the high point of the shoulder. GB21. Jianjing is indicated for symptoms such as rigidity and pain in the neck and shoulders, or pain in the back and shoulders, or any obstruction of circulation to the arms. It's also very helpful for insufficient lactation as well as mastitis. And very important to remember that this point is contraindicated during pregnancy. So any period during the pregnancy. So because when we stimulate this area, it pushes the energy downward, and that's what we don't want that during pregnancy. Our third point is Ren 17, or conception vessel 17, Danzhong. The translation is the center of the chest. It's the influential point for qi. So in locating Ren 17, it's useful to locate the angle of Louis, which is this protruding bone here on the sternum, and that will lead us to the second rib. So from the second rib, go down one more, that's the third, the fourth, and right on the sternum is Ren 17, right on the anterior midline. Indications for this point includes asthma, chest pain, palpitations, insomnia, and especially also very useful for anxiety. Our fourth point that we're going to locate is P6. The translation is inner pass. The Chinese name is Neiguan. In locating P6, you could ask the patient to make a fist, and when the patient makes a fist, the two tendons palmaris longus and extensor carpi flexor carpi radialis will protrude. Can make a tighter fist, and then relax. Yeah, the point is between the two tendons, but too soon above the wrist crease. So again, you can take the patient's thumb measurement, the width measurement, and it's 1 and 2. Go ahead and make a loose fist again. So the point is located between the two tendons, too soon above the wrist crease. P6 is often indicated for symptoms such as nausea and vomiting, carpal tunnel syndrome, headaches, upset stomachs. It's commonly used for motion sickness as well. So our fifth point is LI4. It's on the large intestine channel. The name of the point is called Hegu Valley Junction. LI4 is located between the first and second metacarpal bones, midway between the second metacarpals. So you locate the head and base of the second metacarpal, midway, and it's on the top, highest point of that muscle. Between the first and second metacarpals, but leveled at the midpoint of the second metacarpal bone. So this point is indicated for stress, headaches, tooth pain, facial pain, and neck pain. Our sixth point is LI10, large intestine 10, Shosan-Li. So LI10, Shosan-Li, is located is on the large intestine channel. So between the wrist, the LI5, which is right on the wrist, and the cubital, and LI11, which is at the end of the cubital crease. There's a line of the large intestine channel. So LI10 is too soon below the cubital crease. So this too soon, again, is measured according to the patient's thumb. Measuring 1 and 2. So the point is there. Okay. And the patient's arm should be angled about 90 degrees. It is useful for neck and shoulder pain, abdominal pain, diarrhea, and tennis elbow. The seventh point we will locate is spleen 10, Shui Hai. It means a sea of blood. The point is located too soon, which is 2 finger breadth, thumb's width of the patient's above the medial superior border of the patella. An easy way to locate this point is to cup your right hand over the patella, over the knee, and the thumb will fall on the medial border of the quadriceps femoris muscle. Spleen 10 is excellent for skin diseases, PMS, increasing blood circulation, knee pain, and an excellent point for any issue relating to menstruation, irregularity, or excessive bleeding or pain. The eighth point we will locate is spleen 6, San Yin Jiao. It means 3 yin crossings or 3 yin intersections. We first locate the medial malleolus, and again, using the patient's 3 fingers, we line up the medial joints at the tip of the center of the medial malleolus, and 3 sun, the point is on the other side. Spleen 6 is right there, posterior to the tibia. Not on the tibia. You clear the tibia, and the point is 3 finger breaths above. And this point indicated for symptoms such as menstrual issues. It's great for fatigue, also insomnia, menopausal symptoms, night sweats, hot flashes. It's a great point to help regulate the menses. The ninth point that we'll learn is stomach 36. This is the command point of the abdomen, a very powerful point in the stomach channel, one of the most effective points among the acupuncture points. In locating stomach 36, we locate the eye of the knee, which is adjacent to patellar ligament here, and again is 3 sun, which is the 4-finger breath of the patient's, and the patient's finger breath is similar to mine, so I'm going to use my finger breath. 4 fingers, eye of the knee, you line it up. 4 sun below is at the base of the 4th finger. So you locate the point, and it's 1 finger breath from the tibia. You want to give it space, and the point is in the depression there on the tibialis anterior muscle. Yeah. You want to make sure that you don't go too posterior to the tibialis anterior muscle. It's only, here's the tibia, is only 1 finger breath. Right, so my finger is leaning against the bone, and this is the crest of the tibialis anterior muscle. And the point is level, is on that crest, 3 sun below the eye of the knee. Yeah. This point is indicated for symptoms such as fatigue, depression, any knee pain, gastrointestinal discomfort. This is the command point of the abdomen and the stomach. So diarrhea, stomach pain, any issues that we would see in gastrointestinal disorders, symptom-wise in terms of pain and discomfort. The 10th point and last point that we will learn today is liver 3, Tai Chong. Locating liver 3 is located between the first and second metatarsals. So here's the first, second metatarsal, and you follow it up to the junction of the first and second metatarsal. Clear that junction, and its liver 3 is located in the depression, right there, between the first and second metatarsal. So liver 3 is very useful for stress, low back pain, high blood pressure, limb pain, insomnia, and emotional upset.